Year-old with a herniated disc and sciatica and absolutely was suffering with a near-death experience, came to see us and got better. Give you better understanding. Doctors are not obligated to report their outcomes. I mean, you don't always know what you can expect from specific types of treatments. Our goal is to help you so you can make better decisions. This is a good story. We talked on Friday about you're never too young and you're never too old. The one on Friday, I think she was a 15-year-old, and we talked about a 12-year-old that had sciatica as a result of a herniated disc. Now this gentleman, he's 93 years old, and he had a severe herniated disc, and it was causing him a severe case of sciatica to the point where he couldn't take the pain anymore. And we do get these stories, but in his case, back pain and sciatica for 2 years. This is case study 1022. This one is a great story, and I think you'll learn a lot. The best part is how much you can learn here. So, before he came to see us, he had seen a chiropractor, seen a physical therapist, had the injections, took the narcotics, and he was no better. None. He had seen a massage therapist, had gone to an acupuncturist, and he did not get any better. Because he had a large herniated disc and sciatica, he went to the office of a surgeon. Saw the surgeon reviewed the MRI, found out on his MRI that he had a very large herniated disc and it was pinching the nerve. We've talked about this 1,000 times. This is sciatica. Okay? Had a severe case of sciatica, 93 years old. Surgeon said, you might benefit from the surgery, but because we have to do a fusion, which is the most advanced type of procedure to the spine, there's a good chance you won't live through the surgery. We're not going to do the surgery. So he said, you're not going to do the surgery, we're not going to do it, and you won't find another surgeon to do it. It's just not a good idea at your age. So what they did is they sent him home. And they sent him home, said just rest at home and see if it gets any better. Well, when he was at home, couldn't get the surgery. The only thing that helped take the edge off his pain, and his pain was an average was a 9. Typical, end of the day was a 10. The only thing that took the edge off his pain was Aleve. Aleve is a non-steroidal anti-inflammatory, and there on the bottle, on the Aleve bottle, it tells you how much you should take and how much is normal. Well, 240 million people are currently using over-the-counter medication for pain. 44% are taking more than the recommended dose. Now, there's a reason I'm telling you all this. I'll get to that in a minute. 27% of the people who are taking more than they should are taking it because they have pain. We've talked about the problems with narcotics and overdose, but this is also a problem. And sometimes you don't think of it because you can buy it right over the counter. You think, this is not a problem. I can take this. I can take lots of this. It's not a problem. Well, what they know, and you've probably heard this, is when you take high doses of non-steroidal anti-inflammatories, you will get bleeding in the intestines, and you will get ulcers, and you can get kidney failure. Now, in the case of our patient, this is before he saw us. He tried all those other therapies, not gotten any better. Now he's in the office of a surgeon, says we can't do surgery on you. Sent him home. Sent him home, and what he found was the one thing that helped him take the edge off his pain, and here's his video. We're going to put a link to his video in the description or in the link above. And the one thing that he found was taking these non-steroidals took the edge off his pain. So he was stuck in bed. He couldn't get out of bed. He would take a handful, not 3 or 4, whatever the dosage is. He'd take a whole handful, swallow them down, take the edge off his pain. Wouldn't solve his problem, took the edge off his pain. Eventually what happened is he'd taken so much that he started to have a bleeding ulcer. One day he laid down because he wasn't feeling good. His wife went to check on him and he was bleeding. He was hemorrhaging from his nose and his mouth blood coming from his intestines. Rushed him off to the ER, to the hospital. When they get to the ER doctor says, call a priest, he's not going to make it. Called the priest comes in, reads him his last rites. Well, eventually he started getting a little bit better, and he actually got better. And he went home. And when he went home, they told him no more anti-inflammatories, no more non-steroidals, nothing. Just go home and rest. He went home, and now the pain's at a 10 every day because he has nothing to alleviate the pain. He saw our commercial on TV, came in to see us. This is his story. I want you to watch this story. It'll bring a tear to your eye. He's a tough Marine, tough gentleman. So I want you to watch that because it's really a great story. We have a 9-step process. Part of that 9-step process is identifying exactly what's causing the pinching of your nerve. He had a herniated disc. We talked about that. He had a bulging disc. He had a degenerated disc. He had stenosis. He had sciatica. We've talked about the degenerative cascade. Everything starts to break down. As it breaks down, what happens is the opening physically gets smaller from the herniation, from the bulge, and from the stenosis. He had all that. He had years and years and years, lifetime of sort of breakdown of his spine. Herniated disc pinching the nerve. We talked about that. Bulging disc, kind of like a flat tire where the disc bulges out, pinches on that nerve. Degenerated disc, pinching the nerve. And then stenosis. 4 of the 5 causes. The only one he didn't have is spondylolisthesis. He had everything. Breakdown. Pain was at a 10. He came to see us. His pain, again, between a 9 and a 10. Every day. And it wasn't just every day for a week. It was every day for months and months and months and months and months. Could barely get out of bed. His oswestry was a 78. And the one thing we know about oswestry is 80 and above, you're crippled. You're bedbound. Okay? He was there. He was right there. We know he was a candidate for surgery, but the surgeon would not do the surgery because of his age and because of the type of surgery. Came in to see us. Tough dude. Came in. At the end of our therapy, 42 visits, was right around 4 months. His back pain was a 1, his sciatica was a 1, his oswestry was an 18. He got his life back. I talked to him a couple years later. Okay? We have the ability to solve the problem of the disc. That's the one thing that makes us different. It was the one thing that helped him. It's the one thing that helps all these people that we talk about in these case studies. Okay, they're important. It's important to understand what's available. We solved the problem in the disc. His problem was in his disc. We took him from sort of a pain, suffering, frustrated confusion to being able to do the things that he loved to do. I talked to him after he graduated our program. He said he got his driver's license back. When you get to be 93, you have to take a driver's test every year. He couldn't take the test because he couldn't get out of bed. Got his driver's license back. He was walking 2 miles a day and he was playing golf. He was doing the things he loved without any pain at all. And he had a near-death experience. That's the story for today. The lesson is you have to be careful with narcotics. You have to be careful with the non-steroidal anti-inflammatories, but you also need to know outcomes. What is the outcome? Outcome is the most important thing when you're making decisions about healthcare. You need to know outcome. Doctors are not obligated to publish it, so you don't always know. That's why we do this. If you like what you hear today, I want you to like our Facebook page. And I want you to share this information with your friends and family. If you have somebody right now that is suffering and not getting better and they need our help, send them to us. We will help them. Share this information with them. At the same time, I want you to subscribe to our YouTube channel. I want you to follow us on Instagram. And I want you to follow us on the Twitter. We're here to help you. We do this every day to share information with you. Making the best healthcare decisions is the most important thing. It's more important than anything else to be able to live a quality life. That is our goal for you. Tomorrow we have tips. We're going to talk about a few different things. We've talked about lifting boxes. We've talked about sitting in the chair. Tomorrow we're going to talk a little bit about how to sleep. So that's one of the things we're going to talk about tomorrow. Okay, we use a lot of pillows, so we'll talk about that. So I hope you found this information helpful. Subscribe, follow, and like, and share. See you tomorrow. Thank you very much. Have a good night.